In the latest season of The White Lotus, the prescription medication Lorazepam takes center stage as a key element in the characters' lives. While this powerful drug, often used to treat anxiety disorders, is portrayed in a relatively light-hearted way in the show, the reality of its effects and potential dangers is far more serious. Despite its widespread use, Lorazepam is not a simple, harmless medication. It carries significant risks and should never be taken lightly, especially when misused. Lorazepam, classified as a benzodiazepine, is often prescribed to manage high levels of anxiety or panic attacks, and it works by enhancing the effects of a neurotransmitter in the brain called GABA. This can lead to a sedative effect, making the user feel calm and relaxed. However, this calming effect is precisely what makes it so dangerous. As Dr. Gail Saltz, a clinical associate professor of psychiatry, points out, Lorazepam has a high potential for addiction, both physiologically and psychologically. Over time, users develop a tolerance, meaning the same dose no longer has the same effect. This can lead to an increase in the dosage, which heightens the risk of dependence and overdose. What's particularly troubling is the ease with which individuals can become psychologically hooked on Lorazepam. The drug's ability to alleviate anxiety can create a false sense of relief, encouraging people to take more of it, even when they do not truly need it. The reinforcing nature of Lorazepam can lead individuals to misuse it, as seen with Timothy's character in the show, who uses the drug indiscriminately to cope with overwhelming panic. This behavior is a clear warning sign of addiction, as the drug works to suppress anxiety temporarily, leading the user to feel better and thus more inclined to continue using it. The risks associated with Lorazepam are not limited to addiction. When taken in excess, Lorazepam can cause respiratory depression, which may result in the person stopping breathing altogether. This is especially true if it is combined with other central nervous system depressants, such as alcohol, opiates, or sleeping pills, an extremely dangerous combination that can be fatal. The show highlights this risk when Timothy, already dealing with severe anxiety and depression, consumes Lorazepam alongside alcohol. This dangerous mix could lead to dire consequences, including death, which Dr. Saltz warns against as a real possibility in such scenarios. Even when used as prescribed, Lorazepam can have serious side effects. It impairs motor control and can cause sedation, dizziness, and muscle relaxation, factors that make it unsafe to perform tasks that require focus, such as driving. These effects are compounded when someone develops a tolerance to the drug, requiring higher doses to achieve the same calming effect. The withdrawal symptoms from Lorazepam can also be severe and include spikes in blood pressure, flu-like symptoms, confusion, and in extreme cases, death. If a person who has become physically dependent on Lorazepam suddenly stops taking it, the withdrawal process can be both painful and life-threatening. Despite these dangers, Lorazepam is a controlled substance for a reason. It is highly addictive and carries the potential for abuse. However, as the show portrays, many individuals continue to misuse it without fully understanding the consequences. This can be especially troubling in a world where people, feeling desperate or overwhelmed, may resort to whatever means they can find to manage their anxiety or stress. The portrayal of Lorazepam in The White Lotus may downplay its dangers, but in reality, this is a drug that can quickly spiral into a dangerous cycle of dependency. For those struggling with anxiety, the solution is not always as simple as taking a pill. There are numerous other ways to manage anxiety that do not come with the severe risks of Lorazepam. Cognitive behavioral therapy, CBT, regular exercise, meditation, and breathing techniques are all effective methods for addressing anxiety without relying on medication. While Lorazepam can be a helpful tool in some cases, it is not a long-term solution and should only be used under strict medical supervision. The portrayal of Lorazepam in The White Lotus serves as a reminder of the drug's potential for abuse and the serious risks associated with it. While it may offer temporary relief from anxiety, the long-term consequences of misuse are far from glamorous. The dangers of addiction, overdose, and withdrawal are very real, and it is crucial that viewers understand the gravity of these issues. The show may entertain, but the message about Lorazepam and its risks should serve as a warning to anyone considering its use for managing anxiety.